In this video we are going to cover the pharmacology of antitussive drugs. Antitussives are natural alkaloids or synthetic compounds that suppress coughing, also known as cough suppressants. These drugs are thought to work by inhibiting cough reflex arc in the central structures, for example in the medulla, or in the sensory neurons of respiratory pathways. First, let's discuss about the classification of antitussive drugs. According to where they act, cough suppressants can be classified into centrally acting agents and peripheral agents. Centrally acting agents work by inhibiting the cough center in the medulla. There are three categories of centrally acting agents, and these are opioids. Examples of opioids: codeine, ethylmorphine, fulcodine. The second group are non-opioids. Examples of non-opioids: noscapine, dextromethorphan, clofidinol. The third group of centrally acting agents are antihistamines. Examples of antihistamines are chlorpheniramine, diphenhydramine, and promethazine. Now let's talk about peripheral agents. They reduce cough by acting on the peripheral components of the cough reflex. There are two categories of peripheral agents, and these are specific acting peripheral agents, such as prenoxidazine, and non-specific agents. Examples of non-specific agents are expectorants, which are medications or natural ingredients that help clear the mucus from the airways; local anesthetics, which are commonly used to block the cough reflex during endoscopic procedures; nasal decongestants, and also bronchodilators such as salbutamol. In order to understand the mechanism of action of antitussive drugs, we should understand the cough reflex and its components. The cough reflex has both sensory or afferent nerve fibers, mainly via the vagus nerve, and motor or efferent components. Pulmonary irritant receptors in the epithelium of the respiratory tract are sensitive to both mechanical and chemical stimuli. The bronchi and trachea are so sensitive to light touch that slight amounts of foreign matter or other causes of irritation initiate the cough reflex. The larynx and carina are especially sensitive. Terminal bronchioles and even the alveoli are sensitive to chemical stimuli such as sulfur dioxide gas or chlorine gas. Rapidly moving air usually carries with it any foreign matter that is present in the bronchi or trachea. When triggered, impulses travel via the internal laryngeal nerve to the medulla of the brain. This is the afferent neural pathway. The cough center is located in the medulla oblongata in the brainstem. The afferent neural pathway then follows, with relevant signals transmitted from the medulla via the vagus and superior laryngeal nerves to the glottis, external intercostals, diaphragm, and other major inspiratory and expiratory muscles. The mechanism of cough is as follows: diaphragm, external intercostal muscles contract, creating a negative pressure around the lung. Air rushes into the lungs in order to equalize the pressure. The glottis closes and the vocal cords contract to shut the larynx. The abdominal muscles contract to accentuate the action of the relaxing diaphragm. Simultaneously, other expiratory muscles contract. These actions increase the pressure of air within the lungs. The vocal cords relax and the glottis opens, releasing the air at over 100 miles per hour. Here you can see the structure of the bronchial wall. I will show only the most important constituents. So here we have cartilage, mucous glands, epithelium, smooth muscle. Bronchial smooth muscle contraction induces airway narrowing. Also, you can see the bronchial lumen. Other important components of the bronchial wall are pulmonary irritant receptors present within the respiratory epithelium. So pay attention that I wrote stretch receptors instead of irritant receptors. It's not wrong because stretch receptors also send fibers to the cough center. As a side note, Irritant receptors are also called cough receptors, and they can sense and respond to a variety of chemical irritants. Efferent signals from these sensory cells may initiate coughing. Now let's talk about antitussives. First, let's discuss the mechanism of action of specific peripheral acting agents, for example prenoxidazine. This compound belongs to the class of organic compounds known as diphenylmethanes. Prenoxidazine, marketed as Libexin, is a cough suppressant. It acts peripherally by desensitizing the pulmonary stretch receptors. Therefore, there is a reduction of cough impulses originating in the lungs. Prenoxidazine is indicated in cough of bronchial origin. If prenoxidazine is desensitizing the pulmonary stretch receptors, we'll have fewer action potentials sent via afferent fibers. In this way, we'll inhibit the cough center. That means fewer action potentials will be sent to the respiratory muscles such as the diaphragm via the afferent fibers, and the cough will be inhibited. Now let's talk about non-specific peripheral antitussives. The first category of drugs are local anesthetics. Intravenously administered local anesthetic agents are widely used to inhibit cough. For example, nebulized lidocaine inhibits both mechanically and ammonia vapor-induced cough. Nebulized tetracaine appeared to be more potent and to have a significantly longer duration of action than lidocaine. Airway anesthesia is commonly used to block the cough reflex during endoscopic procedures. The second category of drugs are expectorants. They increase the volume of airway secretions and also help clear the mucus from the airways. People may take them to help alleviate congestion due to the common cold or flu. One expectorant, guaifenesin, is commonly available in many cough syrups and tablets. Other category of drugs, mucolytics, reduce the viscosity of the mucus. Mucolytics, such as carbocisteine, break down the chemical structure of mucus molecules. As a consequence, the mucus becomes thinner and can be removed more easily through coughing. Both mucolytics and expectorants help clear mucus from the airways. Thus, the stretch receptors from the lungs will be less stimulated. Therefore, there is a reduction of cough impulses originating in the lungs, and will have fewer action potentials sent via afferent fibers. So, the cough will be suppressed. Other category of non-specific peripheral antitussives are bronchodilators. They are a type of medication that makes breathing easier by relaxing the smooth muscles in the lungs and widening the bronchi. They are often used to treat long-term conditions where the airways may become narrow and inflamed. As an example, we can use beta-2 adrenergic agonists, such as salbutamol and formoterol. Due to bronchodilation induced by these drugs, it will be easier to cough up the mucus. Because of that, pulmonary stretch receptors will be less stimulated. That means we'll have fewer action potentials sent via afferent fibers to the cough center. In this way, we'll slightly inhibit the cough center and cough. We have discussed specific and non-specific peripheral antitussives. Now it's time to study the mechanism of action of centrally acting agents. First, let's talk about the pharmacology of antihistamines. A typical drug from this class is diphenhydramine, which is used to relieve cough caused by minor throat or airway irritation. Diphenhydramine, while traditionally known as an antagonist, acts primarily as an inverse agonist of the histamine H1 receptor. It also crosses the blood-brain barrier and inversely agonizes the H1 receptor centrally, in our case specifically situated in the cough center, thus inhibiting it. Its effects on central H1 receptors cause drowsiness and other sedative effects. Like many other first-generation antihistamines, diphenhydramine is also a potent antimuscarinic agent. so it can cause dry mouth, nose, throat, and constipation as side effects. Now let's switch to another important class of centrally acting antitussives, opioids. Opioids are the only clearly effective centrally acting antitussive drugs and are thought to work by suppressing the brainstem cough center through mu and kappa opioid receptor agonism. They are the first-line symptomatic treatment for severe, distressing cough. Codeine is an example of opioid antitussive drugs. Codeine is an agonist of the mu-opioid receptor. It acts on the central nervous system to have an analgesic effect. But since we are talking about the antitussive effect of codeine, it's important to know that by acting on mu-opioid receptors, it inhibits the cough center. Common adverse effects associated with the use of codeine include drowsiness and constipation. Less common are itching, nausea, vomiting, dry mouth, miosis, orthostatic hypotension, urinary retention, and euphoria. Now let's talk about centrally acting non-opioid agents. Dextromethorphan is a drug that belongs to this category. Dextromethorphan is a medication most often used as a cough suppressant in over-the-counter cold and cough medicines. It is sold in syrup, tablets, and spray forms. Dextromethorphan does not have a significant affinity for the mu-opioid receptor and exerts its therapeutic effects by acting as a non-selective serotonin reuptake inhibitor. Dextromethorphan and its major metabolite dextrorphan also block the NMDA glutamate receptors at high doses. Side effects of dextromethorphan at normal therapeutic doses can include body rash, itching, nausea, vomiting, drowsiness, dizziness, constipation, diarrhea, and sedation. At the end, let's talk about two categories of drugs that have a minor effect on cough suppression, which are nasal decongestants and mucilaginous herbs. Decongestants are a type of medicine that can provide short-term relief for a blocked or stuffy nose. By doing that, the number of action potentials generated by the irritant and stretch receptors in the nose will decrease and the cough center will be less stimulated. Herbs high in mucilage such as slippery elm, mallow, and marshmallow are often helpful for symptomatic relief of cough and irritated throat. Mucilage relieves irritation of mucous membranes by forming a protective film. As a consequence, the number of action potentials generated by the irritant receptors in the pharynx will decrease, and you know the story. It's important to mention that there are also drugs that can act as centrally and peripherally acting agents at the same time. Benpropyrin is a cough suppressant that has this double mechanism of action. This concludes our lecture. Thank you for watching.